Hi guys, I'm Dr. Saifullah, and today I'll tell you something about the uh, medicines or how we prescribe medicine to someone who presents to us. For example, if a patient comes to you with some complaints like he has sore throat or something like that, or he's not feeling well, so the common practice is the people think that this is a very sometimes people think there's a very serious problem and they must get rid of that and they want instant and very powerful medicines for that. But being a doctor, what I think and what is the common practice and what we have learned in our books or during our mbbs course, uh, actually, during these minor issues, we must not prescribe antibiotics. Now, what are antibiotics? Antibiotics definitely they are not very rare. Actually, they are prescribed mm, on daily basis to up to almost 70% patients who present in OPD. These medicines actually kill bacteria, but they don't have any effect on other microorganisms like the virus or the fungi or other microorganisms if they are causing the problem. So, but as the practice in Pakistan, as I have seen that most of the doctors, when a patient present to them with that I have some sore throat, I'm not feeling well, etc., they just prescribe these antibiotics along with some other supportive medicines, and this they become a regime of 3 to 4 drugs, and that is just given to the patient. But actually, in fact, this is a very wrong practice because every human has its own very sophisticated immune system by nature, and definitely that immune system has the ability to fight with every microorganism or any other foreign body. So in these minor ailments there is no need of prescribing antibiotics. As a doctor, when a patient comes to me that I have some sore throat, I have cough with runny nose, etc., what is my prescription? I'll prescribe him paracetamol, which is available with different brand names like Panadol, Calpol, or some other brands. And the other thing which I would prescribe is antihistamine, which is according to the first generation, which are not now prescribed anymore because they are sedatives, and the second and the third generation, which are less sedative, they don't enter in your central nervous system. So they are cetirizine, loratadine, and now their isomers like levocetirizine or desloratadine, and similarly is the fexofenadine. And the other thing I'll prescribe is, if there are complaints of cough, there is some expectorant which may be in syrup form, and mostly I prescribe the one which is from the local herbs, etc., and which is not dangerous and which has least side effects. So with these supportive treatments, I'll advise the patient to take gargles and to avoid this very cold water. Along with that, he must avoid sour food, which is mostly fruits like oranges, etc., lemons. He must avoid that, and inshallah he'll recover within a very short period of time.